but it's amazing when you get brilliant people to kind of communicate about it. You know, it just makes it a little more accessible. And I do think that the committee has managed to create that for today's conference. And so I am having the pleasure of introducing our sponsoring partner. And so I have the privilege of introducing someone to introduce the speaker. And so, because I would be remiss if I didn't talk a little bit about Brown County Public Health Partnership in this endeavor. And so in the earlier session, I told you all a little bit about just having conversations, talking a lot, normalizing the conversation, and it's really beautiful kind of these beautiful outcomes coming out of that. And that's exactly what happened with Anna, Nick, and I. In a different conversation, we started talking, and what we recognize is though people keep them separate, they're actually connected, because the truth is it's all connected, right? Domestic violence is connected to public policy, is connected to health equity, is connected to eliminating disparities, is connected to health and all. It's all connected, and it's just great when you have like minds coming together and saying, I'm willing to put some resources together to have that happen. And so Anna Nick is our public health official at Brown County Public Health, and she will be introducing our keynote tonight. And so I want to remind you all that there are additional beverages downstairs on the outside of the keynotes, inside of the original room, and that I want to introduce Anna Nick. So thank you so much.
All right, it is now, we're going to pretend it's afternoon. We're 2 minutes shy. So good afternoon, everyone. I wanted to start off and just acknowledge a few things. For those who had the opportunity to listen to Renita's story this morning, it blew me away. Renita talks about that relationship and those conversations and how we can work together, but doesn't talk about, I think, how much she probably moved many of us in that room. So I just want to take a moment, pause, recognize you, Renita. You're just an amazing woman. And what great presenters so far. I mean, this is an excellent conference so far. And all of that we know is due to people like Dr. Renita Robinson, the team who worked to put this together, the presenters having to get ready for us today. So that's a lot of work that we don't see always for this to get put on. And just again, just want to say thank you to all of you for putting on such a great conference so far. So I do see a lot of friendly and familiar faces in this room. But for those who do not know me, my name is Anna Nick. I am the Public Health Officer and Administrator for Brown County Public Health. Brown County Public Health is proud to sponsor in part the 2023 Implicit Bias Health and All Policies Conference, along with Prevea Health and the Brown County Coordinated Response members from Family Services, Golden House, and Wise Women Gathering. We were able to provide the support to the Wisconsin DHS Coronavirus State Fiscal Recovery Funding, which is received through the American Rescue Plan Act, also known as the Public Health ARPA dollars. These dollars were provided to local and tribal health departments in part to provide resources to meet and address emergent public health needs, including measures to counter the spread of COVID-19, and to provide programs or services that address disparities in public health that have been exacerbated by the pandemic. The mission of this conference was a perfect fit for the Public Health ARPA dollars because we knew the health inequities contribute to an increased risk of illness and death for members of racial and ethnic minority groups and contribute significantly to rising costs in US healthcare. Such inequities were exacerbated throughout the COVID-19 pandemic. It was also an opportunity for us to introduce health and all policies as a strategy that can be applied to improve the health of all who live, work, learn, play, and worship in Brown County. We know that overall health is shaped by more than the individual behaviors that we do. And the strategy promotes the integration of health considerations into decision-making across sectors and policy areas to promote optimal health and well-being across the community. It's an intentional and collaborative effort that started locally with the Brown County Racial Equity Ad Hoc Committee and is being focused on by the Brown County Health Equity Coalition Structural Change Work Group, which is led by Dr. Katrina Nordyke, who is in the room. Applying this strategy takes all of us working together because, as Helen Keller once famously said, alone we can do so little, together we can do so much. That is why I am particularly excited to introduce to you our keynote speaker, Becky Johnson, the Vice President of Strategic Partnerships for Change Lab, a nonprofit organization with an innovative approach to health and all policies, supporting translation of this concept to educational and practical tools for implementation. As Vice President of Strategic Partnerships, Becky focuses on developing and implementing Change Lab's partnership strategy and plan in support of programmatic work, national visibility, and organizational sustainability. Additionally, throughout her time at Change Lab, Becky has led work on health and all policies, children's mental health, and workforce development activities for supporting public health professionals with using the tools of law and policy to address health inequities. Prior to joining Change Lab Solutions, Becky was a program analyst at the National Association of County and City Health Officials, where she conducted research, developed tools and resources, and presented on a range of topics, including health and all policies, environmental health, cancer control, and food safety. She worked at the American Psychological Association on the socioeconomic status related cancer disparities program. She has also served as a lecturer at the California State University, East Bay, teaching courses on environmental health, health behavior, and health education. Becky graduated from UC Santa Barbara with a BA in anthropology, and from George Washington University, where she received her MPH in health policy. Please help me welcome Becky Johnson to the stage.
Thank you so much for that warm welcome. I have to say, it's such a pleasure to be here back in the Midwest. I was born in Minnesota, and I spent a good portion of my childhood here in the Midwest. And I have to say, I spent a lot of time in Wisconsin. I've never been to this part of Wisconsin, and it is absolutely beautiful. Maybe the weather could be a little better, but I know it could be much worse, because I definitely remember one Halloween dressed up as a witch with my entire snow gear underneath my witch costume because there was a blizzard. So definitely know this is quite lovely weather compared to what it could be. So you heard a little bit about Change Lab Solutions. Our mission is to create healthy communities for all through equitable laws and policies. And the reason we got started is now, more than 30 years ago, our founder was working in tobacco control. And she was going out and educating youth on why they shouldn't smoke. She was going out and talking to people who wanted to quit smoking, why they should use cessation services. And she found that she just wasn't successful in moving people's behavior because our systems were failing them. And so she decided to go to law school. And she got her law degree, and then she founded Change Lab, and we started working with health departments in the state of California. And we worked with health departments to understand laws and policies and how we could change the environments so that youth were less likely to start smoking, and that it made it easier for people to quit. And in the first 10 years of our existence, we helped lower tobacco rates in California, and we helped the state save $130 billion. Which is huge, right? And the Robert Wood Johnson Foundation saw this, took notice, and they said, we want you to do what you did in tobacco control and take it to the nation and help the nation build healthier communities for all. And so we started that. We went out, and you see all the different areas we work on: housing, transportation, food, safety, the built environment, and we had incredible success. We helped a lot of communities adopt policies that really improved their communities. And yet we started to notice something, that despite all of our great work, disparities were staying the same, and in some cases even widening. And so we knew we needed to do something different. And what we needed to do is we needed to center equity in our work. Because if we were really going to change the numbers, we had to address inequities in our policies. And so we have, for the last several years, really continued to work on these issue areas, but really aimed at addressing the fundamental drivers of inequities, which I will talk about what those are in a little bit. Now, our workforce is very diverse, both in terms of our demographics, as well as our professional backgrounds. Many of us at my organization are like myself, with a background in public health. Some of us are planners, city planners, communications specialists, and a lot of us are attorneys. I am not one, but when you work with attorneys, they make you read the fine print. And today's fine print is that everything I'm sharing is for informational purposes. I'm not giving any legal advice. You wouldn't want my legal advice. I'm not an attorney. Not entering into attorney-client relationships, and that there's no intent to reflect any view on any specific legislation. So you heard my bio, which was long for my ears, but who am I? Why do I do this work? Well, that could be a whole day long presentation, which I'm sure would not be particularly riveting for most of you. But I'm going to start with two stories about why I do this work. The first reason I do this work, the year after college, I was working a job that was just not the right fit for me. I was not happy, and I knew I needed to change my life. I needed to hit Control-Alt-Delete, clean the slate, and start over again. And so I applied for, and I got a job teaching English in Japan. And that I moved to Japan with a cohort of teachers, mostly who were from the US, a couple from the UK, or Canada and Australia. And every single one of us moved there for this grand adventure of living in a new country, but none of us made any grand decisions about adopting, getting healthy or getting fit or anything like that, right? I didn't do whatever the fad diet of the day was. I didn't do whatever the exercise fad was of the day. No CrossFit for me. Still don't want to do CrossFit. If you do, great. Definitely do what makes you happy. And yet, every one of us who moved to Japan, who didn't make any of these big changes, we ate more Japanese food than we had ever eaten before, which is delicious, but I still ate and cooked the food I knew how to make, right? And so that meant even when I was going out, like I would still order fried chicken. If you ever have the opportunity to try karaage, which is Japanese fried chicken, it is really delicious. But it was served in slightly smaller portions with different sides than we have in the US. And I went from driving to work 40 minutes each way to walking or biking or maybe taking the bus to work if the weather was bad. And so these little changes that happened just because my environment changed, within 3 months, there was a measurable biomedical professional's difference in my health and every single teacher that moved with me in my cohort. And that for me was this profound experience of how powerful our environments are in changing our health outcomes. And so at the end of my time in Japan, I wanted to move back to the US, and I knew I wanted to be part of an effort to change our environments. And I knew that the way to change our environments was through law and policy. So I moved to Washington, D.C. because I thought that was the only place you could do policy. And naivety in your mid-20s, give me grace, please. And now I know that some of the most powerful policy is done every day at the local level. And we're going to talk about how you can become involved in that work. The other reason I do this work goes back further to my childhood. When I was growing up, I lived in Section 8 housing, and I was on food assistance. and we were eligible for other government programs, but we kind of learned about them a little too late. And yet I didn't know I was poor. I didn't know I was poor until a well-intentioned educator took us in the 3rd grade on a class field trip to see where poor people got their food, which is where my family got our food. And I tell this story, there's a lot to unpack in that story about well-intentioned educators, but that's not the reason I'm telling this story. The reason I'm telling this story is in the 1970s, Minnesota adopted a lot of policies and implemented programs to help families like my own, to provide the assistance that was critical for my family during those rough years in my early childhood. And what I firmly believe, because I've seen it with my own eyes, when you invest in people, they can do amazing things. My parents, because of that financial investment, eventually went on. My mother became an air traffic controller. My dad became the vice president of a consulting firm. They bought a house. They sent all 3 of their kids, myself included, to college. And it was because of those investments. But the thing I didn't know at that time is that those investments, those policies and programs were not given out equitably to all families. In fact, families of color were much less likely to be able to take advantage of these programs. And it is for that reason that I always think that we need to center equity in our approach, because I've seen the power of these policies, and I know that everyone should have access to them. So what are we going to talk about today? Well, first, we're going to talk about what law and policy is. I know some of you, this is maybe very familiar. Others of you may not be familiar. So we'll just do some baseline setting on that. Then we're going to talk a little bit about our legal history and how that affects health outcomes today. We'll talk about what health in all policies is, what you can do to promote health in all policies, and hopefully you'll identify at least one action you're going to take after today. So what is policy? Policy is a written statement of a position, decision, or course of action. It is made by public, nonprofit, or business sectors. It applies to people within an organization or jurisdiction that adopts the policy. So policies can be laws, they can be procedures, they can be contracts, voluntary practices of government. Whereas laws are ordinances, statutes, case law, executive orders, and regulations, and other things. So in other words, as we say at Change Lab, all laws are policies, but not all policies are laws. And this is important because all of you, it doesn't matter where you work, whether it's a nonprofit business, whether it's for a government agency, you all have the ability to set policy or work on policies to advance health. And policies can be adopted at the federal level. It's probably like in my 20s. Remember, I went to DC thinking that's where all policy got set. It's embarrassing. But it can be done at the federal level, the state level, the county, city, or the organizational, institutional levels. And the policies that have the biggest impact on health outcomes are the ones that get at socioeconomic factors. Policies that get at poverty, education, housing, inequality. Those have the biggest impact on health outcomes. I want to do a little bit of a history lesson, hopefully not too boring. But I know this photo is kind of hard to see. I hope you bear with it. It's 130 years old. So technology, it's gotten a little better. But over here on the left-hand side, that's trash. That is what the streets looked like before 1893 in New York City, and not just in New York City, in many towns around the country. And what was happening is that if you lived in a wealthy neighborhood, you could pay to have someone come and remove that trash off of your streets. But if you did not live in a wealthy neighborhood that could afford to pay for those services by yourselves, the trash would build up like this: food refuse, leftovers, there would be animal feces, vermin running through there, rats, mice, bugs, and whatnot. And you can imagine how much disease was just out there in the atmosphere because of the lack of sanitation laws, right? In 1893, they passed sanitation reform, and this is the same street after that reform. And you can see how big of a difference this was. And over the course of the 20th century, we adopted many laws and policies like this that were really aimed at improving health outcomes. And because of this, we extended the life expectancy. In some cases, we doubled it by at least an average of 30 years between 1900 and 2000 because of laws like these. And yet, we still see major differences in life expectancy based on where we live. And now there could be many reasons for that: environment, different rates of diabetes, smoking rates, et cetera. But the reason for that is because law is a factor that affects health, and we see differences in how laws have been implemented and adopted that drive these differences. Now, I know this is California. I don't usually like to use a California example. As someone who's born in the Midwest, I don't care about California, but I'm using this because it's a well-documented case. If you see in Fresno, where it marks Fresno, exit 132, the life expectancy is 75 years. If you look at exit 140, the life expectancy is 84. This is in the same city. Now imagine what 9 years means. Think back to where you were 9 years ago and what you were doing 9 years and everything you've been able to do over the last 9 years. Think about what that means is if you retire and you live long enough to see your grandchildren make it to 4th grade versus living long enough to see them graduate from high school. What does that mean for the person who lives to see their grandchildren graduate from high school? What does that mean for their kids and the grandkids in multiple generations having that family member still around? That's the difference here we're talking about. And the reason for this is because of laws and policies in Fresno. And now I'm calling out Fresno, but Fresno is not an outlier. They're not unique in this. We often talk about federal policies and how federal policies like redlining, which was around a policy around where investment would happen. And they literally drew maps around areas that were primarily people of color communities where there wasn't going to be investment. And those policies definitely affected these numbers. But there are also local policies that drove this. And I'm going to go back to 1918 because that's where we have this documented. I'm sure it goes back before 1918. But starting in 1918, the city used its land use policies to isolate the most affordable housing and the most highest polluting factories in the same neighborhoods. And they did that intentionally because they did not want Chinese immigrants to have the same opportunities as the rest of the residents in Fresno. This use of policy would continue onward for the entirety of the 20th century. In the 1940s, with the Dust Bowl and the westward migration of people, they reinforced those policies so that it continued to have affordable housing in one pocket in the town and the highest polluting, again, the highest polluting factories. In the 1950s, when the federal, there was the building of the highway system, there's Highway 99 that you can see here, local decision makers made sure that that highway literally broke up that community to weaken their power. Then in the 1960s, 70s, 80s, and 90s, they continued to drive investments in universities, job opportunities, and people in the northern part of this town, and they continued to make sure that those investments did not go to the southern part of this town. And so understanding, I don't know what the laws are here specifically, but understanding the history of your laws is really important because these laws that result in these disparities and these differences in life expectancy happened at every level of government and every organization and institution. And so it's important to understand it so that you can change it. So I think that's that slide. Health equity. So what do we mean by health equity? I know we talked about this. I'm sure you've had definitions. This is from Paula Braveman. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences. Now, I'm going to use this image because I think it's a good image to kind of explain the difference between equality and equity. Let's say one of our interventions where we're going to give everyone a bike because we know biking is great. I don't know. I like to bike. Maybe you don't like to bike, but Now you can see here, if we gave everyone the same bike, that's not going to work for everyone, right? The girl on the right, she's too small for that size bike. And the boy on the left who's in a wheelchair, he can't physically use the bike. And so we would want to, equity is this idea that we give everyone the type of bike that they need to fit their frame, and so that they can use it. I think this is a great image for highlighting the differences, but I don't think it's a perfect image. Well, one, I don't believe in perfection, but two, I think, you know, do the people want to have bikes? Do they have bike lanes in their community? Can they even use a bike? Those are also questions you want to add into the mix that this graphic doesn't do a great job of showing the difference of. And I would say this is a priority. Even here in Wisconsin, I see that your Governor's Health Equity Council report says exclusion, discrimination, inequitable policies, programs, and access to resources are not only morally wrong, but they also are economically short-sighted and contribute to less freedom and less well-being for all of us. And so that is why at Change Lab, we are working for those reasons and many more to address the 5 fundamental drivers of inequity. And what that is addressing structural discrimination and specifically structural racism, income inequality and poverty, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. So how do you do that? Well, I'll tell you when the best time to do that. That was probably 20 years ago, 100 years ago, or 400 years ago. The second best time is today. This is a Chinese proverb that comes from my colleague, Renee. She's amazing. And we all have the opportunity today, starting today, to really start addressing these drivers, looking at what is in our power to change and how can we use our positions to make that change. And one way to do that is through Health in All Policies. Health in All Policies is a collaborative approach to improving the health of all people by incorporating health considerations into decision-making across sectors and policy areas. This is the definition that I think Renita was referring to in her opening remarks introducing us. But it also comes from the American Public Health Association and the Public Health Institute's Health in All Policies, their seminal guide to Health in All Policies. And there are many reasons for why Health in All Policies is an effective tool. I'm going to give 4 reasons. And these 4 reasons come from working with communities for more than almost 15 years now who've implemented this. I'm going to give you these reasons because this is what has resonated with their leadership on advancing Health in All Policies. But these are not going to be all the reasons that Health in All Policies is the case making that you're going to make. You're going to need to find the reasons that will resonate with your leadership. But the first one is that every government agency, every organization affects health. Every single business, organization, healthcare system, obviously healthcare system is in their title, government affects health. And we need all of us working together to tackle some of our biggest challenges. Now, let's say you wanted to work on violence prevention. I think many of you are. One policy that we know can reduce violence, not the only policy, is policies that get at economic insecurity. And so let's say you're like, okay, I want to work on economic security, and I want to look at policies that can help that. Well, I know housing is one area that I could work on because housing affordability puts pressure on families' incomes. And so if you're paying more than 30% of your income towards housing, that takes away from your ability to buy food, to pay for healthcare, to pay for other services that you might need. You could also work on educational policy, right? Because people who finish high school are more economically secure, and then people who finish college are even more economically secure. So you could work on education policy. Just in these 3 areas, that could be 50 different policies that you're working on to achieve that. Then you start looking at all the other policies that go into this, healthcare policy, food policy, land use policy. Remember, I talked about how in Fresno, all that money went to the north part of Fresno and didn't go to the southern part of Fresno. And before I know it, I'm overwhelmed by these mutant-sized butterflies that are flying at me with my very small net here that does not proportional to the size of the butterflies. And I realized I cannot do this alone, nor should I. I need need to do this as a team and in partnership. The third reason people do health in all policies is because it can be a vehicle for improving efficiency. This is an argument that works really well in places I've seen a lot in the South, that they use this a lot as a reason for health in all policies. And if we literally look at our org charts, we're all in a bunch of boxes siloed apart from each other, right? And what health in all policies does is it gets us working together as a team, literally breaking down those silos. This is from a community that implemented health in all policies. They had it was a county level effort, and the county would go out to the cities within their county to meet with them. And the county would go and not talk to each other. And so in a week, the city might get visits from 3 different county departments. And it was driving the cities bonkers because they're like, how many times are you going to come visit me this week? And so when they started to adopt health in all policies, they started to identify when this was happening and they could streamline this effort together. The fourth reason is that health in all policies can improve economic well-being of a community. More than 50% of economic growth in the US was directly due to the results of improvement in population health. Imagine what you can achieve with 30 extra years of life and what that means in terms of what kind of business you can develop. I will say, at 30, I didn't know what I was doing. I know better now, and I hope in 10 years and in 20 years, I know a lot more. And that's all because of longer lives. So what is health in all policies? What does that really mean? We know we're supposed to collaborate. We're supposed to incorporate health into decision-making. What does it actually mean? Well, it really comes down to 3 things. It is about using the power of law and policy, the power of collaboration, and the power of community to drive change. And the communities, and over time, it results in permanent changes in how agencies relate to each other and mechanisms to ensure health lens in decision-making processes. And when I look at, there's been many communities that have adopted an ordinance that requires all government agencies to cooperate with each other. And then they usually have a community engagement advisory board. They all have, so a health in all policies policy, what we call the pizza of policy. When this is adopted in an ordinance or a resolution or an executive order by a mayor or a county council, they always have the same 5 elements: that you convene and collaborate, that you engage and envision, that you make a plan, that you invest in change and you implement that plan, and you track progress. Now, this is what all the policies that implement health in all policies have. These are also steps that even if you're not ready to adopt a health in all policies policy, a pizza policy, you can take those steps to incorporate it into your professional practice today. And we're going to talk about how to do that. So let's start with number 1, convene and collaborate. The first one is about building relationships and create a team. I am curious, how many of you have been working in your role for at least a year? Can you raise your hand? How many have been doing it for more than 5 years? More than 10 years? Okay, so it looks like 5, about the average is at least 5 years. And this is going to be some hard math for me right now. I think there's about 170 of us in this room. So we're talking about almost 850 years of experience just in this room. And when you look around here, you all are experts in your communities. You all are experts in the work that you do. You all have the power here to change your communities together. And so core to this is about building relationships and connecting into people, both within your organization and outside of your organization. So who do you already have on your team? And who do you need to add to your team, both internally and externally? Who in here have you not met or do you not work with on a regular basis, who you can forge a relationship today with? And then think about how you want to frame the initiative. I'm using health in all policies because that's kind of a general term for this, but communities use what works best for them when they're implementing this. So you don't have to call it health in all policies You can call it whatever is going to resonate for your community. So for some places, they wanted to work on poverty. And so they took all of the steps that I'm talking about it, and they used it around reducing poverty in their community. Some places, the focus is on wellness, and they want to really drive towards promoting wellness. Other places, it's sustainability or social justice and racial equity. Find a frame that works for you and where you live and when your team and partners, and use that frame to move this forward. You don't have to call it health in all policies if that's not going to work with your leadership. Find a frame that works best for you. And then prepare for pushback, right? Inevitably, we'll get some pushback. One of the communities we talked about, they gave these 4 enemies of change. And this is by no means all the pushback you might get, but some of that is that, oh, we've always done it that way. We're not going to change, right? Or we've never done that before. I don't know how to do that. Or we tried it once and it didn't go well. Or that's a great idea, but it's too late. Think about what kind of pushback are you anticipating and how you might work to address that pushback. And then always look for win-wins. When you're trying to build relationships with different sectors, and when you're trying to build new relationships, it's not about what I want, it's about what you want and what we can achieve together. So look for those win-wins. So if you're gonna put this into practice, whether or not you are gonna adopt a policy today, which I don't think we have the authority to do that here in the room, who needs to be on the team? What is the best way to bring them to the table, and how should the team work together? Think about that. Next, and engage and envision. This is about creating a shared vision for improving outcomes. Now, I said outcomes and not health here because, again, going back to that framing, find what frame is going to work best for your community and stick with that. And then engage the community. Be creative in how you solicit feedback and gather input from the full community. The communities that have been able to push health in all policies the furthest have gone to the community, heard what they had to say, and used that for justification with their leadership. And you don't have to use what mechanisms you have. Maybe you're providing direct services and you can use that input to inform decision makers on what needs to happen. Maybe you're going door to door and asking for input on stuff. You can do that. Use whatever makes the most sense. But whatever you do, make sure that you include the communities that are most affected by disparities. So low-income communities, communities of color, communities with limited English proficiency, whatever it looks like in your community. And use the opportunity to build community power. In one of the communities that we worked with, they were trying to work on health and all policies, and they were doing community meetings about the benefits of health and all policies. And the community residents were like, I don't know how to connect with our elected officials. I don't know where they are. I don't know how to meet with them. They're not listening to me because how do I connect with them? And so they use their community engagement process to respond to that community's needs and to tell them, this is when the community meetings are. This is how you get on the agenda. This is how you present, so that they were building that power and really responding to what the community was asking for. And another place, what they were running into is that the community was like, this is all great, love it, whatever. We don't have a laundry. We don't have a laundry facility. There is no laundry in our apartment buildings, and there is no laundromat that's close by. We need a laundry facility because having clean clothes is a requirement for employment, and we need that. And so they listened to what the community said, and they really made sure that they got laundry facilities for the community. The last one is assess your existing law and policy landscape. I talked about Fresno and looking at understanding those laws. The only way that they were going to change those policies is if they understood what the policies they currently had, and then they could identify options to change them. So think about what opportunities already exist to engage residents and key partners. How are you going to reach the whole community? And what laws and policies are currently promoting health? Because there probably are some laws that are doing a really great job. We talked about sanitation reform, helped extend life pretty extensively. And which ones are harming health? And how can we change those? Then you're going to want to make a plan. You want to identify policies and actions that will improve health outcomes. This is important because I think we all sit in different roles, right? So some of us may be a judge, and we're making decisions every day, and then we can make laws. Well, we are making laws because we're doing case law, but many of us sit in different roles, right? We might be employers, maybe we fund projects, maybe we provide services, maybe we do education, maybe we collect data, maybe we do none of this, maybe we do all of this. Think about your role and how can you apply a health, equity, and sustainability lens to the work that you're doing right now to improve health outcomes. For example, Kansas City, Missouri, they wanted to do a health and all policies policy, right? They wanted the pizza of policies, but their leadership wasn't ready for that. And there wasn't community demand for it either. And they started to take a real hard look, and through their community engagement process, they realized they were not doing a good job of engaging the Black community in Kansas City. In fact, they had no relationships with the Black community in Kansas City. And so they went and they met with faith-based organizations in Kansas City, and they found an organization that represented a big chunk of the community, and they created a memorandum of understanding with that group, and they created a shared space with the community organizers to talk about what the needs are. And then together, the city and the organizers, they ended up starting to look at where those policy opportunities were. They started small. It's okay if you have to start with the girl with the butterfly with the one policy. It's okay if you start there. Like that is okay. And what they did is they ended up adding life expectancy to the city business plan because of that relationship. And they're continuing to build on that to better advance health and all policies. Over time, what you want is every government sector and community partners, businesses, healthcare, et cetera, looking within what is their control to change. And this example, the community was focused on equity in all policies, essentially. And they asked every government agency to look at their programs, services, and policies, and how could they better embed equity into those policies and programs and services. And the transit department went and they did a deep process of looking at this. And they were like, well, one thing we could do is we could reduce bus fares for low-income residents. Bus fare is $1.50 each way. Buses create opportunities to connect people to jobs, to food, to healthcare. And if you think $1.50 each way, that's $3 a day for one round trip venture. And if you, I don't know what ramen costs here, but in Las Vegas, ramen's about 50 cents a packet, right? So $3 is potentially 6 meals that I could be feeding my family versus taking the bus, right? And that can have a huge impact on how I'm feeding my kids or how I'm feeding myself. And so the transit department's like, we can do a program that lowers the price of bus fare for our low-income residents so that their health outcomes could be better. And that was really within their power, their control, and that's something that they identified themselves that they could take. And that is a huge win, right? That's phenomenal. And yet that program is only as good as the number of people who enroll in it who are eligible. And like I said, in my family case, there was a lot of programs we were eligible for, but we just didn't know about it, right? And so this is where the power of health and all policies comes together, because you have each sector looking at their own laws and policies, and then you have that team that can help roll out that program to the entire community. And so they activated that team. So anytime any resident had any interaction with their government, they were hearing about this program. There was people who could help them enroll. So if you went to the library, if you went to parent-teacher night, if you went to the DMV, you paid the utility bills, you were learning about this program. There was information about this program, and they had huge uptake. And that's where health and all policies really meets its magic moment. So think about, what do you want to achieve? What policy options will help you achieve those goals? And what steps can you take collectively and individually to achieve those goals? Next, we're going to talk about how to invest in change, or how to implement your plan. Now, in the interest of time, I'm not going to go through all of these, but I'm going to, you can do things like training your staff about health and all policies, giving time for staff to go meet with other sectors, You could apply an equity lens to your informed decision. You can update contracting, develop tools, find resources. But I want to give an example from one community who's implemented this plan. So first they started by training their staff. We're going to take an equity in all policies approach, and they trained their finance department. And their finance department was like, okay, one of the things that we can do is we can require everyone who's making budgets to do an equity audit of their budget before we finalize it. Then, and they developed a tool to help each department do that equity audit. And then they followed up on that tool by meeting with each department to talk about, okay, so what kind of assistance do you need? Let's go through your budget. Where are there places where we could go even deeper with this? And so think about what kinds of tools you would need to implement this and how you can support people with implementing it. The other thing I would say is it's about maximizing your resources. Now, it would be great if we all had a large grant that allowed us to do this work. And if you can get it, definitely apply for it. But I want to say nobody has, this is from a community that was able to do this without a grant. They said that nobody has money. We have people and we have resources. We do not have money. But they found that if they could work together, you can actually make it all work. So that's not to say that you can't go out and find grants for this and, you know, try to do that, but also recognize you have resources that, and take a look at what resources you already have and you can tap into to move this along further. So again, ask yourself, what can you do to implement change? How can you leverage existing resources that you already have? And what new resources might be needed and how can you attain those resources? Then the last part about this is about tracking progress. This is about evaluation and measuring success. If we had more time, I could talk about this, but what I really want to focus on is about celebrating every win, big or small. There was this community I was working with, and they came to me and they were so dejected. They were like, oh, Becky, this has been really hard. We have this partner that we don't have a good trusting relationship with. And we are just struggling and building a relationship with them. And there's good reason why there's not trust. They spent 2 years trying to get that partner, build a relationship with them, because they had years to undo that mistrust that was there. It took two years before that partner was like, okay, you can come to my meeting. You can come, but you got to sit there and you got to be quiet. I don't want to hear anything from you. And so they went to the meeting. And then they spent 2 years just listening, building that relationship. And so at this point, they put in 4 years into that relationship. It was a critical partner. They didn't do that for everyone, but this was a critical partner that they needed a relationship with. And at the end of those 4 years, what they did is they said, okay, we're going to jointly apply for funding together. We have enough trust that we feel comfortable applying for funding. And they received millions of dollars from their state to do change to the built environment, right? Now, if you're going to celebrate successes, you're definitely putting it in the newsletter that, hey, we received millions of dollars to change our built environment. That's definitely a success you're going to celebrate. But I would argue that they needed to celebrate every one of those successes over the 4 years, right? The first time you called that partner that you had a bad relationship with and they didn't hang up on you, that is a success. The first time they invited you to one of their meetings, that is a success worth celebrating. All of those successes that built up over the years, you have to celebrate all of those things. I know, and sometimes for me, you know, when I've had a rough week and things haven't gone well, sometimes the biggest success for me is just getting up the next day and going into the office and showing up, even though everything has gone wrong and I'm feeling the weight of it. That is a success, and you should celebrate those successes too. So just as and hey, if you need to take a day off to like do some self-care, that's also a success, because we don't do that enough as a society, generally speaking. So celebrate every win, big or small. And so I want you to think, what successes have you already had, and how will you measure success moving forward? So again, when we talk about health in all policies, it's about these 5 strategies, and these are steps that you can take yourself right now to start implementing health in all policies, and hopefully over time you'll move towards that health in all policies ordinance or executive order or resolution. Now, I do want to talk briefly about policy change. I often hear from people, oh, I can't do policy change. That's not in my job description. Well, I first would say that you can change policies within your authority. Maybe you're on decisions about staffing, or there's organizational policies you can always change. Maybe it's about changing maybe you want to do a trauma-informed system, adopting those kinds of policies. And I would also say you should always follow the guidance of your organization, funder, or legal counsel. And if you have any questions, you should reach out to your local counsel about this. But I would say it's important to understand what exactly lobbying is, because I feel like a lot of people tell me, oh, I can't do policy because I can't lobby. And that's true. Most of us can't, unless we're a registered lobbyist, we can't lobby. But lobbying generally has 4 components to it. The first is, it is a communication. We're talking letter, phone call, email, meeting with a government official or employee who takes part in forming the legislation. It reflects a specific view on that legislation, support or oppose, and it's about a specific piece of legislation. So for example, if I called my elected official or my city council member and I said, I want you to vote yes on this bill, that would fall under this definition, right? Because I have all 4. I'm doing communications with government official. I'm saying support, vote yes, and it's about a specific piece of legislation. I can't do that in my job. Like, I could only do that after work, right? The same thing as if I emailed all of my friends from my work email, dear everyone who lives in my city, please vote yes on this city council measure, or call your elected official to vote yes on this. That would also count as lobbying. I can't do that either through my work. But there's a lot of things that you can do when it comes to policy that is not lobbying. You can build coalitions. You can conduct nonpartisan research and analysis. You can broadly share best practices, success stories, evidence-based policy approaches. You can do educational campaigns that explain the advantages and disadvantages of public policies, and you can provide presentations or testimonies in direct response to written technical assistance. On this one, again, still follow your guides of your funder and organization, but generally speaking, you can do that. And what does that mean? So let's say you're creating a team and you're like, okay, I want to work on paid sick leave policies, because we know paid sick leave helps people access needed services, both mental and healthcare, for themselves and for their family members. So you could start doing research about paid sick leave policies, work with a team of organizations. Maybe there's multiple organizations who are potentially interested in this. You could broadly share best practices or success stories, because a number of communities have adopted these kinds of policies around the country. You could talk about evidence-based approaches. You could even do an educational campaign that says, we need paid sick leave because this is beneficial for workers, beneficial for health outcomes, mental health outcomes. And what's the disadvantage of not having a paid sick leave policy? And then if someone reached out to you that asked for your testimony and gave you a written invitation, that was an elected official, we've heard what you've done, we're interested in maybe doing some legislation on this, would you come testify about what your findings are? Assuming your funder and your organization allow you to, you could do that. And that would not fall under legislation or lobbying, because it was not, you're just providing nonpartisan analysis of why paid sick leave is beneficial. So as we come to a close, this is a quote from Grace Lee Boggs. She's an author, social activist, and philosopher. We never know how small activities will affect others through the invisible fabric of our connectedness. In this exquisitely connected world, it's never a question about critical mass. It is always about critical connections. Think about what critical connections you are making today and what you can make afterwards. And this is a Zen proverb that says, the seed never sees the flower. The steps that you take today, you don't know what the flower it's going to be, but you are planting seeds that can fundamentally improve the work that you are doing for the people that you're doing it for. So what seeds are you going to plant today? I want you to all write it down before the end of the day. Think about what seed you want to plant today that you can take to move health and all policies forward. If you like these resources I talked about today, or you're interested in some more about policy change, we have a lot of different resources on our website. We have over 1,500 policy resources out there. So depending on what your policy is that you're interested in, we probably have something about it. And if you want to access it, you can get it at www.changelabsolutions.org. If you have any questions, you can, of course, email me at rjohnson@changelabsolutions.org. Or contact us at info@changelabsolutions.org if you don't want to talk to me, but you want to talk to our organization. That's fine too. And thank you so much. It's been a pleasure. If there's any questions, I'm happy to answer.
Excellent, Rebecca. And so did anyone have any questions? I mean, there were so many things that back there. Yes, yes.
So I thought it funny when the state legislature so that these things if the elected official gas minister is absolutely fucking right.
I'm sorry, I couldn't hear it. I don't know the very frightening part, but I missed the first part.
People run for office for against health, against equity, against policy, and they're to take our little seeds and mow them down with us to the lawn. What do you guys think about changing those dynamics? And I watch friends in public health who are looking how to get the hell out. It's true in law enforcement, it's true in teaching, it's true in a lot of things, but it feels so hopeless to try and coalition build to take 20 years. You got people get elected who are trying to mow this all down and start to.
Well, that is a complicated question that I'm not going to be able to solve with the amount of time that we have, but I think it's a really great question. I'm not, we don't do lobbying. So I don't have like I'm not talking to legislators in Minnesota, for example, but there is a resource that is from the American Heart Association, and maybe I can share it with you, Renita, afterwards, and we can send it out. It talks about the 9 archetypes of different ideologies when it comes to people who may not have health as their primary motivation. And then they talk about what kinds of framing you want to use when you're talking to those communities, because those elected officials, because you're right? Like we're living in probably the most divided we've been since like the 19th century. And that is a real uphill battle. So I don't have all the answers, but I would refer you to the American Heart Association's guide, and I can make sure to send it to you, because it talks about how do you talk to those people who are adamantly opposed to what you are saying, and what is the messaging to get at that. I would also say that's where building partnerships is so important, because there are still people who if we come together, we can move the needle on. So I know that's not like, it's a little bit of a wishy-washy answer because it's so complicated. It's a great question. But that would be my 2 recommendations: is build partnerships where you can, and then also take a look at that resource, because that does talk about how to reach those elected officials who are just like, I don't want any policy and health isn't a priority for me. Oh, yes, I'm sorry.
So along the same line, how do you not get discouraged?
That part where I said you got to celebrate every win. I try to really invest in that, and some days I'm better than others. I think there's a lot in our media. We have kind of a sensationalized media that tends to like focus on the negative, and there's a lot that you can focus on. But I go around and I travel the country and I meet with communities like yours on a regular basis. I talk to communities like yours on a daily basis, and people are doing such great work all around the country and I hear it even in this room in the little bit of conversation I've been able to listen to. And that's what keeps me going, because I think the majority of people really do want what's best for their communities, and they're just trying to figure out how to do it. And there are so many great groups that are out there doing it on an everyday basis. And the place that people have the most trust is actually in local government. And that's where you have some of the biggest impact for policy change, is at the local level. And sometimes, a piece of chocolate really does help. Any other questions? Yes.
something that I always try to contemplate how equity is that it should be a strategic point for every health organization, because if you think about the population growth by 2050, this minority or people of forward will be the majority. So if we don't know how to respond to the needs of these people, we will, whatever is the competition, does a better job, then there's a problem in our house. So I think we are just narrow-sighted, and we're thinking just what is in front of us, and paying attention to this politics, trying to cover the sun with a finger. But in reality, this should be a thought for everyone here and every organization that the population is changing, and nobody will stop it. But if you know how to serve them, you get better service. So that's nice.
Yeah. And I would say that inequities affect all of us. When you look across the country, it affects all of us, and we're being intentionally pitted against each other. And so if we're going to overcome that, we have to work together to change that. So yes. Any other questions? All right. Well, thank you so much.
All righty. Thank you so much, Rebecca. And I just wanted to make sure that you all knew the folks that were working behind the scenes to bring this conference to you. So if you are from Brown County Public Health and was a part of this work, please stand up. And if you were a part of the Coordinated Community Response and the Diversity and Inclusion Committee that did the planning of the conference, please stand up and let's give some honor and acknowledgement to them. Very great. And so you all, there is a QR code that will help you to know where your next session is. And it's also on the TVs that are in the lobby and the foyer. But I wanted to let you all know that we are working to get the evaluations done. And so an email, the same email that you were communicated with for your conference registration, will be receiving the email, and it will probably be on Monday. There is a QR code available now, and so you certainly can access that now, but an email will be sent, and with it will be the resources that some of your speakers have talked about. And so be on the lookout, because we will compile the resources and we'll get those things to individuals. And then I want to make sure that you all know the folks that stood up, they're your contact people for some of the pressure points that have been discussed in the different presentations. So we want to make sure to connect you with them. So that you will have access to those things. We have the rest of the day that's available with some more really fantastic content. And so I encourage you all to check out the registration, the conference, the links that has the different locations for the different remaining sessions, and to be on the lookout for that email. If you were invited and hadn't gotten registered, please get in contact with one of the members of the committee, get in contact with myself, and we'll make sure that we get those resources to you. And so let's give all of the folks that worked on this another round of applause, and thank you all for hanging in there.